Welcome everybody. The first topic I want to talk about is piggybacking on our last podcast regarding on making sure we do everything for our patient before discharge. And I think that was important because it brought up Lala and I were at a continuing education meeting, and there was a nurse practitioner and a doctor on the panel, and it was the doctor who actually mentioned the nursing model. So I wanted to just talk about that a little bit and what the nursing model is actually about. For our nurses and nurse practitioners, you're well aware that we practice a holistic approach. We don't only treat the symptoms, but we like to treat the whole patient as a whole. So if there's something going on, not only medically but psychosocially, we like to reach out to those resources to help them out. Is that correct?
No, yeah, for sure. I mean, case managers are part of the team and they're registered nurses for the most part. Some nurse practitioners served as case managers, and that's where, again, it starts just like Christy said at the beginning, day one of hospitalization is discharge. So you're already talking about that whole picture of the patient.
Yeah, and then I think how Margie was talking about the holistic approach, it's also what the patients don't tell you. The look in their eyes, like Margie mentioned the other day when we were talking about this, is sometimes the way they look at you, they can't afford their medication. So.
Correct. So we're just talking about nonverbal communication and looking at that as well. So I just kind of wanted to touch base on that a little bit. So my topic today is actually talking about vertebral fractures. So I will be doing a talk, so I want to invite all nurse practitioners, physicians, PAs, registered nurses, and anyone who wants to come to learn about this topic. It'll be on March 23rd from 8 to 12 at the Oso Creek Del Mar campus. So please come and join us. But today I'm just going to talk a little bit about that so that you have an idea.
A teaser, right?
A little teaser, yes. So, all right. So most spinal fractures are caused by injury or trauma, accidents, or falls. However, according to the National Library of Medicine, it is most common in elderly, especially those who are in postmenopausal state. So 25% of vertebral fractures are actually in women who are postmenopausal. So with that being said, that only increases at least by 40% when they hit the age of 80. So it's very important. I've noticed throughout our practice, we see a lot of elderly women come in with vertebral fractures who have, the most common reason is, the etiology part is the osteoporosis. So I don't know if any of y'all seen that in your practice.
100%. I mean, how many elderly trip over their dog and it's a fracture?
Or sometimes they don't even have to fall.
Yeah.
They can just say, I turned this way. Yeah, I did this and have a severe pain, and it's crazy.
That is correct. And what they were saying, the most common for those with severe osteoporosis, the most common fracture is a vigorous cough or a turn in one direction or the other.
Picking up the grandchild.
Correct. And light heavy lifting, not even heavy lifting, it's light. With the moderate osteoporosis, you see them with more of a trip or a fall, or actually lifting heavier items. So it's very important that I've seen, again, in our practice, that osteoporosis is actually, there's a big gap in that area. Many of our patients are not being treated with any type of medications, biologics, any of those.
Or screened.
Or screens.
Exactly. Correct. It's like that's a big thing in primary care. Where are your patients getting bone density
prevention?
Exams,
right.
Prevention.
Like
65, or have they had a broken bone before? Have you screened that patient, or what's going on? Just like Margie said, that postmenopausal. Another underdiagnosed one is males. Just I know by Margie is I sent a patient the other day to get a bone density, and the technician actually told my patient, why are you here? And I was just thinking, wow, well, he broke something. he's at this age and we need to screen them. And that's why, and the patient actually kind of chuckled with me because it was kind of like, why are you here? Because he was a guy. So that's just something to know.
Yes, and speaking on that point, men also at the age of 65 and over are at risk of vertebral fractures as well. So yeah, we can't exclude our men. We have to include them as well. Again, just piggybacking, the most common cause is postmenopausal osteoporosis, and the main thing to look for in regards to symptoms, because a lot of times patients they have back pain, but after a few weeks it subsides, and then when they're coming and like, hey, did you know you have a fracture? We have an X-ray. You have a fracture. They're like, oh yeah, I had back pains long ago, but it went away. And well, now they have this chronic fracture. Well, does it need to be addressed? No, not necessarily, because they're asymptomatic, but they didn't even know. Could that have been the cause of osteoporosis? Yes, more than likely. But again, they're not being treated.
Well, to say that as nurses, like, I mean, I have back pain like every day.
We all know nurse back.
When you've like lifted patients for 20 years or so, I mean, it's nothing for me to need to leave like every day. So
Yes.
I could have a vertebral fracture. No, hopefully not. Just kidding.
Let's do next one.
Are you postmenopausal?
Not
Okay. Well, then symptoms to look for is, sudden onset of back pain, intensity of pain increases during walking or standing, and the complications that can occur from vertebral fractures are continuing low back pain, which again causes them to not want to engage in any activity, so decreased activity, decreased mobility, which also can impair pulmonary function. So it's just a ripple effect, when
Or
it's
cause a DVT that leads to a PE.
Because they're not moving around, those
Yeah,
type of
and
things for
mobility.
sure.
exactly. And other complications can include thoracic kyphosis and lumbar kyphosis. So if you see your patient hunchback like that, so it's
I've
just
heard too, sorry, one little thing is like if they feel more comfortable pushing a cart, like because they're used to that, like they need that to be stable, like that's how like their back is now.
yes, they feel comfortable in this position, right? Correct. So that's just a little blurb about vertebral fractures and osteoporosis. I don't want to give all of it away because we do have a CME coming up. So please come and join us. I would greatly appreciate y'all for your support, and so would our team.
Oh, yeah.
But if you have any other questions, if you have a parent, a mom, or dad's like, hey, I've noticed this. They've been having this, dorsalgia, a chronic pain. Well, please leave some comments and we'll get back to you as soon as we can. So thank you.
Good. That's good.
How many hours do you get at the CE thing, by the way?
4.
4 hours.
4 hours. Okay.
And we'll also be talking about HRT and those type of things that you say honestly affect osteoporosis, and we need to make sure that we get that information more out there to our healthcare professionals, and we hope that you guys can join us because it is hosted by the Coastal Bend Advanced Practice Nurses, partnered with Del Mar, and having great speakers like Margie herself to help share that knowledge. So
in our Facebook page, NP Table Talk, we will post a link so you can register to that event.
Yes.
Okay.
So that's great.
And then what was next on our agenda for today?
Well, I was going to go a little bit more, even just with the vertebral fractures, just because I had a little bit of feedback of the kyphoplasties when they get those little fractures. Back in the day, it was like neurosurgeon brought it to the Coastal Bend, and then it was kind of like, wow. Now, fast forward, it's about 20 years almost. And they're doing it in pain management, keeping you out of the hospital. So those are those type of referrals to talk about with your providers, and just a little bit of knowledge out there about even those compression fractures when they're that sudden onset, just like Marty said. And of course, you want to talk to your primary care provider about that.
Yes, for sure.
Your professional, your doc, always though. We're just here to try to serve.
Well, now that she mentioned kyphoplasty, that is the treatment of choice. If you do have a vertebral fracture that you've had ongoing pain greater than 6 weeks, So, you know, after that, it hasn't resolved, well, then you're definitely a good candidate for a kyphoplasty. So it is a 1-day surgery in and out. You don't have to stay in the hospital unless there's more complications, you know, with more comorbidities that you may have to have it done in a hospital opposed to the outpatient. So yes, thank you for bringing that up.
No, because I just find it neat that you know, healthcare again is always evolving, even in procedures and everything else that even comes to our area post. You know, sometimes it goes to a bigger city faster, but I mean, it's something that I was like, wow, I can't even believe how fast that procedure has kind of been projected in different arenas with ortho, pain management, everybody working together as a team, and that's kind of what I wanted to share.
Yes. Well, eventually, I think where I work, we kind of want to start focusing on our osteoporosis patients. You know, those which you know that are falling through the gap, right? They're not really being tested or screened and not being treated. So we're slowly trying to begin the process so that we at some point, you know what, we can partner with our primary care physician and ourselves in treating the patient, again, as nursing model, treating them as a whole. So we're trying to work something out. Hasn't been established quite yet, but we're trying to get that going. So that's going to be nice for the community.
I'm sure with you being part of that team, it's going to be great, and I look forward to that, and us always collectively working together as a team to work for the patient at the end of the day.
And it is a team effort. And so one thing we were also going to mention that someone did ask this is, like, what kind of NP specialties are there? Okay, so you've got 3 different ones sitting right here. Okay, so Margie, you're
I'm an adult gerontologist, primary care NP.
Okay, and then I'm adult gerontology acute care NP.
And I'm a family nurse practitioner.
Yeah. So the other ones that we aren't. There's also a primary care pediatric NP. There's acute care pediatric NP. There's psychiatric and mental health NP. And you can also get your further certifications depending on what kind of NP you are. You can get specialty certified as an emergency nurse practitioner. There's even cardiovascular NP, informatics, med surg, nurse executive, and then pain management too. Isn't that kind of cool? We just mentioned that. So not here. I don't know of any pain management NPs, but maybe one day, you know.
Yeah, but that's what's so cool about our roles as nurse practitioners, where we go back to, these are specialty nurse practitioners. They are trained in the assigned board certification that they are trained in school, and the tests that they pass to serve their community in those arenas. And that's what I find so commendable, and again, great with nursing, where we're able to fill in those voids for the community to provide that access to care that's needed here specifically.
Exactly. Well, guys, so I think that's about it for today. Once again, please follow our Facebook page, NP Table Talk. You can also email us if you have any questions. It's nptabletalk@gmail.com. And we look forward to the next time.
Wonderful. And then I'm going to do the disclaimer real quick.
Oh,
the
yeah,
content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or primary care provider with any questions you may have regarding a medical condition, and we want to make sure we stress that. So always follow up if you have questions with your health.
All right.
Thank you.
Thanks.
Bye.